Hi, this is Doctor.Global. The heart is not just an organ. It is a symbol of life, love, and hope. What if we are talking about the chances for a new beginning for those suffering from severe cardiovascular diseases? Today we will tell you about the heart transplant process, a procedure that brings new life and hope to every patient. How does a heart transplant take place? Who can be a candidate for it? And what steps need to be taken to become a donor or a recipient? Let's figure it out. A heart transplant is a life-saving procedure for people with terminal heart diseases. This can be the result of long-term heart failure, coronary artery disease, cardiomyopathy, or other serious conditions. A transplant can be the only opportunity to return to full life. Every year, thousands of people wait their turn for a heart transplant. It is important to realize that every procedure requires careful assessment and preparation. In order to be placed on the waiting list for a heart transplant, each patient must meet the following criteria: have a high exercise capacity, have a high heart failure survival score, have no contraindications, irreversible renal, hepatic pulmonary insufficiency, pulmonary hypertension, cancer in the previous 5 years. Before receiving a donor organ, the patient undergoes a thorough medical evaluation to assess their physical condition. This includes blood tests, ECG, echocardiography, and consultations with cardiologists and surgeons. Unfortunately, there are many more patients waiting for a heart transplant than there are suitable donor hearts, and not all of them live to see the operation. In order to prolong their lives and increase the likelihood of receiving a donor heart, the Bridge-to-transplant approach is currently being used. To do this, terminal patients undergo an implantation of a left ventricle assist device, or LVAD, which partially replaces left ventricular function and helps the heart last a little longer. For some patients, LVAD implantation is an available option to prolong life because they don't fit the criteria for a heart transplant. About 70 to 75% of patients survive for 2 years after implantation of an LVAD, which often allows them to wait for a donor heart. When a donor heart is found, the patient is prepared for surgery. Under general anesthesia, surgeons make an incision on the chest, connect the heart-lung machine. At the same time, another team works in a neighboring operating theater to extract the donor heart and prepare it for transportation. Once both surgical teams are ready, the donor heart is placed in a sterile ice pack and delivered to the surgeons performing the transplant. The main heart transplantation techniques to date are biatrial and bicaval. Surgical teams decide which one is more preferable in each particular case. The operation requires a high level of skill and teamwork. It usually takes 4 to 6 hours. After transplantation, the patient receives immunosuppressive therapy for up to 12 months to prevent rejection of the organ. Recovery after a transplant is a long process that may take several months. It takes at least 2 months for the sternal incision to heal, during which time the patient must avoid serious exertion and physical impact on the chest. Patients undergo a rehabilitation course that includes supervised physical therapy, which is crucial for regaining strength and mobility. Regular sessions with a physician to build a personalized exercise plan tailored to each patient's specific needs and limitations. This period is not only about physical recovery, it also involves emotional support, as many recipients experience a range of feelings, from joy to anxiety. It's essential to foster a positive mindset and encourage patients to engage in activities that promote mental well-being. Family involvement is also critical. They provide encouragement and companionship during this challenging time. As patients progress, they can gradually return to daily activities, often sharing their experiences to inspire others who are on similar journeys. Recovery demands effort and patience, but with the right support and guidance, many patients successfully adapt and return to their normal lives, embracing a new chapter filled with possibilities and hope for the future. Treatment in modern clinics around the world is carried out using various methods and equipment. However, not everyone knows that the cost of medical services can vary significantly depending on the country, even while the quality remains high. To help people find optimal conditions for treatment in the best clinics globally, we've created the Doctor.Global service. Our platform is designed to help you get a second or third opinion, choose the most suitable location for treatment, or find affordable prices and convenient dates. We act as an active intermediary, assisting you in gathering comprehensive information about clinics, translating and organizing your medical documents in any language, and helping you make an informed choice of doctor or clinic. Follow the QR code, describe your situation, and we will contact you for confirmation. We will immediately begin searching for the best treatment options, taking all your preferences into account. Organ donation gives a second life. Legislation on organ donation differs in each country. There are two main systems, opt-in and opt-out. In opt-in, informed consent must be given during your lifetime before your organs can be used for transplantation after your death. Countries with this system include the US and Germany. The other option is opt-out. This means that no active consent is required during life. By default, everyone is considered a potential donor unless they have expressed their refusal to donate during life. Such a system increases the number of potential organ transplants significantly. Examples of such countries are Spain, France, and Austria. Each of us can become a hero to someone by deciding to become a donor. In many hospitals, staff members form a wall of honor to recognize a person who has agreed to donate their organs after their death to help other patients. Although it is a difficult decision, many people enjoy the thought of helping someone to have a chance at a new life after their death. A heart transplant is not just a medical procedure. It is a chance for a new life, an opportunity to take a step towards recovery. A life filled with hope and dreams is worth fighting for. Subscribe to our channel, Doctor.Global. We talk about important health issues.